another session of Community Action Together. And our special guest today is Megan Shreve, who's from South Central Community Action Program, which serves Gettysburg and Chambersburg. So where is that in connection, let's say, to either Philadelphia or Pittsburgh?
Well, we're just about in the middle. So along the Maryland line in Adams and Franklin County. So yeah, South Central, really right in the middle of the state, towards the southern end.
And Megan, how long have you worked there?
So I've been the executive director or CEO for 15 years. Before that, I worked for Deloitte for about 5 years. And then I worked in community action before that for 14 years.
Wow.
I have a good history with community action.
Good history, and
yeah.
Deloitte is a nice addition to your experience as well.
Yeah, it was great. It brought a different level of strategy that I think has been really helpful for me. So it was good.
Let's talk a little bit about what the agency is experiencing now with both health, COVID-19, the economic fallout, plus all the focus on racial injustice and the desire for much greater equity and equality in America. How's that impacting your agency, and how's it impacting your strategic thinking as an agency?
Yeah, thank you. They certainly are complex times and have been challenging in a way that really nothing in my career has challenged us the way this has. But I feel like we've had really significant growth and the adaptability that we've been able to manage through this process has been really great. So I think starting in February, we do a lot of work on social determinants of health. So we had a little bit of an in and saw some of the COVID stuff coming early. So started our plans very early in the process and modified a lot of practices. So we were never closed. Even when Pennsylvania was a pretty hot spot, we didn't have to close the agency. Our shelters remained open, our food pantry remained open, our WIC program, all of those served clients face-to-face and continued through the process. Some of our programs went to working remotely where we were able, but everything focused on how do we keep people safe, and not just staff, right? You know, we have families coming in with newborns for WIC, so how could we serve those families in a way that made sure everybody was safe? And staff came up with great, really innovative ideas. Our WIC program is serving folks through the front window, so a parent can keep their kids in their car and be right in front of it, so they don't have to leave them, they don't have to get them out, they don't have to put their family at risk. And our food pantries that were traditionally doing the grocery store are, we're doing bags of food for those folks and getting deliveries out when possible. And then, we work a lot at the system level as well. So we have a program called Gleaning, which is where we go out after the harvest and we pick what's left. We're pretty highly agricultural communities. And that program was really well placed to be able to do farm to family deliveries. So because we work with so many partners across both counties and we get so much produce out quickly, when there was some farm to family funding and we got some produce boxes on a weekly basis, we could get those distributed all across our county really quickly. And then, we saw such increases in food during that first portion, and not the availability of purchasing food, like, trying to get dry goods was nearly impossible. So working with the community to get the food we needed for families. And now that really has all shifted to rent and utility assistance with the long-term goal of self-sufficiency, of getting people stable and back on their feet. So this will be a big bump in the road, but only a bump in the road, so that they will still have a future story, so that they'll still be able to keep moving forward. So that's where our efforts have turned at this point.
What, speaking of rental moratoriums, I assume that the moratorium is nearing its end in Pennsylvania. Is there a sort of a drop dead date on that coming up?
It was just extended till the end of August. So we have some more time. there has been a really large rental relief program that came through CARES that's being implemented across the state. Many of the community action agencies are doing it. It's almost no administrative or staffing dollars, so it's only funding for families. We are uniquely positioned, I think, to do that because CSBG is such a flexible funding stream to be able to get people back on their feet. Thank you for your work on making that happen. And thank you, in addition, for your work on getting that increase to 200%. That's really, I think, really critical when you're looking at long-term stability for families, that we don't drop them off at 125, but that we can work really hard to get them really stable, because 125 is far from stable. So thank you for your work on that. Really cool.
You're welcome. Unfortunately, we still have a number of states, Pennsylvania, thank heavens not being one of them, but we have a number of states that don't want to go to the 200%, although it was in law. I assume that you're seeing just a crush of demand for services and for help, including on rental moratoriums, et cetera. Describe that a little bit. What kind of increase are you seeing? What kind of change in who's coming to you for help?
Yeah, thank you. It's coming in waves. So early on, before unemployment was really released, we saw huge increases in the number of people needing help for food, and people who've never come for food assistance before. And that once unemployment started to be more normalized, or the process maybe at the state level was more normalized and people got onto a routine of receiving that started to slow down. We anticipate that next week, with that decrease of the $600 in federal unemployment, that we're going to see those numbers increase again. And then the wave for utility assistance and rent has been what's impacting us the most right now. All other programs are really functioning normally. So we're seeing our normal numbers, but there have been additions, especially when it comes to food, rental, and utilities. And certainly shelters are operating differently, trying to make sure that you have space to quarantine in place, so that if you have someone who becomes ill, you don't have to shut down a shelter and displace 10 families. So there are things that we're having to do differently. And then on the system level, we're really working. We have a pretty large Latino population, Latinx population in both of our communities. So trying to get information out to them with the voices of families on how best to keep yourself safe, because we see so many equity issues when it comes to COVID and the families that we serve. So really working at the system level in our communities with the voices of families to be able to share with their neighbors and friends so that we can keep everybody safe.
How's your agency's got a terrific reputation in the communities you serve. How is your activities in these crises we're facing? How has the community responded? And is there greater awareness, greater support for your activities?
Yeah, we have really great community support in both Adams and Franklin County. I feel incredibly fortunate. We do a lot of community level work, and we have a lot of effective partnerships. I think this is highlighting some of this work. When the Franklin County was suddenly receiving $600,000 of rental assistance with almost no administrative costs associated with it, so no money for staffing. There were very few organizations that had the infrastructure to be able to do that. You can't turn away that kind of help for your community. So, in a matter of about a week, we were able to get that written and get it set up, and we were able to move staff who have been working on stability for families for a long time. We could just move them over to be able to deal with this crisis. So I think that the adaptability and trust that the community has, it's been maybe a little bit at the we've been able to show it a little more at the forefront, but we've had great community support. I mean, it's been amazing to me the number of people who donated their stimulus checks to our organization because they knew it would go to families to help get them back on their feet. It's just incredibly gracious. We are incredibly fortunate.
So the flexibility and the additional CSBG dollars allowed you to leverage those toward partnerships and helping the community accept additional resources and meet additional needs.
That's exactly right. And to be able to serve those clients in a way that is so respectful and caring. We work really hard to make sure that our values are not just words. And so our consumer satisfaction surveys show that 98.6% of folks say that we treat them with respect even if we can't help them. So it's not only that you're able to leverage funds, but it's the way that you work with people so that they feel respected and so that they trust you. And then you can help them develop a future story and work towards meeting that. Like that part of it, that relationship, the relationship-based piece of this, I think, has been critically important.
So if the country is dealing with basically a perfect storm in three areas: health crisis, economic crisis, and racial injustice, how has those three issues changed the way you operate? Have they changed it at all? Are you developing additional priorities? Are you doing more advocacy? What changes are going on at the agency?
Yeah, I think that they have changed us. I think the ability to be adaptable. I mean, we've always in this work you have to be adaptable, which is the beauty of CSBG, right? The Community Services Block Grant allows us to meet the flexible needs of our community. But this has taken adaptability to a whole new level. And because you're a trusted partner, both with the families that you serve and with the community at large, you can create space for families to share their stories and their experiences, and you can validate those. So I think sometimes it's holding space. We've had a number of the families we serve have taken Toastmasters classes. And so when we have a panel night or we have a movie to be on topic, or even when we were doing the videos to talk about staying home and wearing a mask, it didn't have to be people in positions of power. It could be the families who we serve, whose voice carries in the neighborhood. They were the ones who were able to share that message, which allowed us to help reduce the spread of COVID. So I think that community action is really uniquely positioned to meet these kind of needs in our community, which makes this really difficult time a great opportunity for us to do real good that will strengthen us in the long term. We found, we have pretty good reach into the communities, but we found some pockets of populations that we just were not working with as well as we could have been. And we've been able to build some partnerships that have been really valuable. We did a wonderful video with our Latinx community, and that partnership I know is going to carry us for a long time in being able to better serve that population of folks and being able to better understand how we can meet their needs. I think the learning that we have the opportunity to gain right now is invaluable. And it's just because we're doing so much so quickly, it's important for us to still take that time to reflect and record those lessons learned. We all had continuity of operations plans. Well, we've actually seen how flawed they were when you have this kind of, with all of the economies, with healthcare, with the issues around race. We can do so much more. We can learn so much through this.
What's the, if you look back, say 5 years from now, hopefully we're looking through the front windshield rather than or hopefully we're looking through the rear view mirror rather than the front windshield on what we're facing, the crises now. Looking back, what would be the one decision that you felt you had to make or you made as executive director, guiding your agency through these difficult times that you're really proud of?
Well, I'm certainly really proud of our staff and that they could listen to the families that we serve. We think we have to have the answers, but generally the folks that we're working with, the folks that we're serving, they have a clearer picture of what their communities need. And so I think listening to them and then being able to set up structures in place that could serve them better. And then I think from a community level perspective, I think that more people in this country have an understanding, whether it's around race, and ethnicity, as well as what it's like to be an essential worker who's struggling to survive, the stress that brings out. People who may not have ever experienced that before are experiencing that. And I think it is a really important time for us to take the advocacy efforts we have on what it takes for someone to be stable in this country. There's a different level of understanding and the stress that comes by when you don't have enough that we need to capitalize on as we move forward, because people can understand that at a different level than they probably in my lifetime would have understood it.
So the understanding, the need for advocacy has obviously changed your agency probably forever. Are there other ways that your agency's going to be changed because of the environment we're in today?
Yeah, I think there are a couple ways. I think the flexibility that we found in serving families, the requirements to bring someone in for a face-to-face on our schedule, it's definitely changed. We found that we can be more effective and be more efficient with families' time and our own. The flexibility with staffing hours, you're trying to accommodate the lack of childcare. So some staff have needed to work later or sometimes on weekends to accommodate their own family schedule, which has given us greater flexibility in serving clients. I think seeing the implications of COVID on our populations, the families we serve, it helps to really highlight the need for us to be working around social determinants of health and figuring out how the voices of the families that we serve can be a much better advocate in those communities when we make space for them to share their stories. So I think there are so many learnings that will change who we are in the best of ways. And listening to staff, seeing the flexibility of staff and seeing some of the inventive things that they've created to keep clients and staff safe in this time. Again, when we spend more time listening to the people who do the work or who are involved in these issues, we can make changes, I think, that we didn't even anticipate we could make, and quickly.
Well, a lot of the key to your success is good staff.
Yes.
And I'd be remiss if I didn't ask, how are they holding up under these difficult circumstances?
Yeah, so it's been a journey. So, from the beginning when you're trying to figure out how do you adapt, and I think that we moved quickly, and then you get into this place where it's suddenly, how long are you going to work like this? And then you get into a rhythm where this is the way it works. And now we're trying to figure out what are the best practices that will stay. We've had those experiences where someone at our shelter has had to go get a test, and how did our quarantine processes work, as well as exposure with staff. So you've been able to strengthen those pieces. But all of that is definitely, it is a weight for people. When you are still serving folks face to face, as you have to in food pantries and shelters, there's certainly a weight to that. So trying to make sure that staff are safe and that clients are safe. We want to make sure that all of the clients that come to us, we have a lot of very fragile folks. So making sure that they're safe. I think that weight is heavy. So, at this point in this journey that we think is going to be here for another year at least in this kind of chaos, it's stressing to staff that you have to take time off. We have to figure out as an organization, how do we support staff well, because their ability to treat clients well is reliant on that. So making sure that we're encouraging folks to take care of themselves, making sure that our practices and policies are safe here, that they feel well supported, I think is really important in this part. But they're doing well. They've made me and the community incredibly proud. And I know that we are helping record numbers of people. So I'm deeply appreciative.
The agency obviously is reputation has grown. It was good to begin with, but now it's grown even more. Demand for assistance and help and just friendship of the agency is probably at record levels. What else do you need? What do you need to continue to meet and deal with the crisis in your community. What do you need out of Washington? What do you need out of Harrisburg? What's missing out there to help you combat this even more effectively?
You know, in the beginning, it was very understandable when things were very chaotic coming to us. This was new and different, and no one had any experience with it. So I think it's really understandable. But there are still so many changes coming to funding and policy and practice that I wish that folks who were making policy could step back for just a second, or even reach out to those of us who are doing the work to get some sense of how do you really operationalize what you're asking for. Because sometimes, I mean, and we've seen this before, but I think record numbers, I was just on a CSBG call where we were talking about the conflicting, you know, one thing you're told today about a funding stream is different tomorrow. And so trying to make sure that you are equitable with the clients you serve and that staff have a complete understanding, it would be helpful if folks could slow down just a little bit when they're developing the policy. And then if they could get the money out more quickly, because that certainly is tough. I mean, we are certainly fronting lots of that funding to get people can't wait. If you're going to be evicted or if your utilities are off and you have little ones, like they can't wait. So we are standing in the gap for that. So I would say those changes are really helpful.
I agree with everything you've said, and I know that when we're doing this, Pennsylvania has not received the local agencies have not received their CSBG money yet. One of the lessons learned for me is how cumbersome sometimes state government is. And there is a definite lesson going forward for us. This was signed into law March 27th. And here it is, the end of July, and a number of states, CAPs have not received their first dollar yet. Totally unexpected. So there are lessons learned on this. But I think the biggest lesson for all of us is CAPs are there. They're front line, they're ready, they're adaptable, and they're absolutely vital in their communities on this. So I'm really proud that you've given a career to community action. The Deloitte background should be helpful in terms of accountability and managing all the money flows on that, but and the different program requirements. But is there any message that you would want to say to the 990 other agencies out there from Gettysburg, Pennsylvania? What would you want to say to them about the fight that we're all in together?
Well, first, I'd want to say thank you. You know, I think those of us who do this work know how hard this work is to do. And then secondly, I would say don't miss this moment. The moment we have to hear the stories of the families that we serve, whether it's around race or class or ethnicity, and the difficulties people are having, to be able to make more space for those families to share their story, to not miss that, and to not miss the opportunity we have for advocacy. When we think about the level of understanding that people have of the stress of living in poverty and fighting, clawing your way out, people can feel that right now, and we can't miss these moments. And certainly, David, to you, I want to say thank you for your tireless work. I appreciate that you've worked so hard to get us to 200% of the federal poverty income guidelines, and that change will now enable us to not just get people off of government assistance, but to get them to stability and to be change makers in our community along with us. So, you know, just really appreciate you and your team's work on all of this.
Well, thank you for those kind words, but it's a two-way street. I've been around for quite a few years. Never have I been more proud of the network than how we're responding to this. And it's directors like you that literally give me satisfaction to know that our efforts in Washington really make a difference in the community because of leaders like you. And
Thank you.
so we'll keep fighting for giving you more resources. We want to give you more responsibilities, more recognition, and so that we can look back and say that this was the defining moment for the Community Action Network, and we met the challenge. And watch out in the future. We're ready. And we're up for whatever
That's
life
right.
presents to us. So again, thank you, Megan, for your leadership. Tell the staff how proud we are. Thank your board for their leadership, their guidance for this, and let's hope in the not too distant future we are looking back at how we survived all this and better times ahead. So Megan, thank you very much. Stay safe.
Thank you. You as well.